Our bodies are constantly sending us signals, subtle signs that something may be wrong long before it becomes serious. Many people dismiss early symptoms as minor inconveniences, fatigue from a busy schedule, or temporary discomfort, but ignoring these warning signs can sometimes have life-threatening consequences. One of the most overlooked indicators is persistent fatigue that does not improve with rest or sleep. While everyone experiences tiredness occasionally, chronic exhaustion can signal underlying health issues such as anemia, thyroid disorders, diabetes, heart problems, or even mental health conditions like depression and anxiety. Similarly, unexplained weight changes, either sudden weight loss or gain, should never be taken lightly. Rapid weight loss can be associated with conditions such as cancer, hyperthyroidism, or chronic infections, while unexplained weight gain may indicate hormonal imbalances, kidney or liver problems, or even heart failure. People often underestimate the importance of their digestive health, dismissing symptoms like persistent bloating, changes in bowel habits, or frequent stomach pain. These could be early signs of gastrointestinal disorders such as irritable bowel syndrome, ulcers, inflammatory bowel disease, or even colorectal cancer. Additionally, recurring headaches or migraines that differ from your usual pattern might indicate neurological concerns, high blood pressure, or vascular issues that require immediate attention. Skin changes, including new moles, unusual rashes, or yellowing of the skin and eyes, are not merely cosmetic issues, they can be early signs of infections, liver disease, or skin cancers. Likewise, frequent urination, persistent thirst, or unusual thirst patterns are warning signs that may point to diabetes or kidney issues. Paying attention to these subtle but persistent symptoms and consulting a healthcare professional early can make a significant difference in diagnosis, treatment, and outcomes. Another set of symptoms that often go unnoticed involves the cardiovascular system, which silently influences almost every aspect of our health. Shortness of breath, even during routine activities that previously posed no challenge, can indicate heart disease, lung conditions, or anemia. Chest discomfort, pressure, or unexplained palpitations should never be ignored, as they could be precursors to serious events like heart attacks or arrhythmias. Swelling in the extremities, particularly in the feet, ankles, or legs, may result from circulatory problems, kidney disease, or heart failure, signaling a need for immediate medical evaluation. Sudden or severe dizziness, fainting spells, or lightheadedness can reflect neurological or cardiovascular disorders and should prompt urgent medical attention. Persistent pain, whether in joints, muscles, or bones, often dismissed as aging or minor strain, might indicate chronic inflammatory conditions, autoimmune diseases, or early stages of osteoporosis and arthritis. Additionally, changes in cognitive function, including memory lapses, difficulty concentrating, or confusion, can be early signs of neurological disorders such as Alzheimer's, dementia, or even vitamin deficiencies that affect brain function. Mood swings, anxiety, or depression that develop without a clear cause or more than emotional disturbances, they can reflect underlying endocrine imbalances, neurological conditions, or chronic illness. Sleep disturbances, like insomnia, restless sleep, or sudden excessive sleepiness, may signal hormonal imbalances, mental health issues, or cardiovascular problems. Recognizing the connection between these symptoms and potential diseases allows individuals to seek timely medical guidance, potentially preventing more severe complications. In the future, it is equally important to be vigilant about subtle changes that might seem unrelated to major health concerns but are often early indicators of serious conditions. Persistent coughs or hoarseness in the voice could point to respiratory issues, infections, or even lung cancer, especially in individuals with risk factors such as smoking or exposure to pollutants. Unexplained fever, night sweats, or prolonged infections may indicate immune system problems, chronic infections, or hematologic disorders like leukemia. Sensory changes, including sudden vision problems, hearing loss, or tingling sensations in the extremities, could be linked to neurological disorders, diabetes, or vitamin deficiencies. Digestive irregularities, persistent heartburn, or difficulty swallowing can suggest gastrointestinal or esophageal issues that, if caught early, are far easier to manage. Changes in oral health, including bleeding gums, mouth ulcers, or persistent bad breath, can serve as early warnings for systemic illnesses such as diabetes or deficiencies. Even changes in personal habits or physical abilities, like reduced stamina, frequent clumsiness, or difficulty performing routine tasks, might reflect underlying chronic conditions or degenerative diseases. Many people tend to downplay these early warning signs, attributing them to stress, aging, or lifestyle factors, but staying attuned to your body's signals and acting promptly can be life-saving. Developing awareness, maintaining regular checkups, and seeking medical advice when something feels off ensures early detection, better treatment outcomes, and long-term health preservation. Understanding and responding to the body's early warnings is not just a precaution, it is an essential practice for proactive, responsible health management.